Hi, my name is Kayla Schifferle, and today I'm going to be talking about my research paper, which was on slap tears. The introduction, I'm just going to talk about the purpose of my literature review, which is to understand the anatomy of slap tears, their causes, athletes' risk factors, and rehabilitation methods to safely return athletes to the field. So to start, I wanted to give a brief overview on the shoulder joint, specifically the anatomy of the glenohumeral joint. So the anatomy of the shoulder, glenohumeral joints are synovial ball and socket joints that connect the head of the humerus, which is your upper arm bone, to the glenoid fossa, a shallow socket in the shoulder. The labrum deepens the glenoid fossa and reinforces stability at the joint. The shoulder has a large range of motion. However, when it makes up in for movement, it lacks in stability, leaving the joint vulnerable to injury. This image is from MRIs of the shoulder. On the left here, the MRI depicts an intact labrum and normal shoulder anatomy, compared to the right over here, which has a slap tear, as labeled right here. MDs can see from the MRI a black hole-like appearance where the long head of the biceps brachii connects to the labrum. And basically that hole is supposed to be solid white in the MRI. However, it's not, indicating that there is a tear or lesion. Slap tears are caused by any sort of trauma to the shoulder. This could be repetitive overhead motions that result in overuse injuries or landing on an arm while the shoulder's in extension. Clinical symptoms of a slap tear may include clicking, popping, or catching motions, as well as weakness, feelings of overall instability, and pain with a decreased range of motion. Once a slap tear is identified with an MRI, patients can choose between two potential treatment plans. The first option is conservative treatment. This consists of rest, pain meds, physical therapy, and sometimes cortisone shots. This is beneficial for players who don't want to take months off to recover. The second, more invasive option for chronic pain is surgical interventions. The rehab guidelines on the slide are post-surgical guidelines for physical therapy. Now, since my internship was with the William and Mary football team, I wanted to focus in specifically on slap tears in football players. One thing that I found was that position can influence the risk of developing a slap tear. Linemen, offensive and defensive, who are often in sustained periods of arm extension at the shoulder, have a higher risk of developing a slap tear. Tears are often associated with direct trauma and compressive forces seen during blocking and tackling. For example, D linemen after the snap strike the opposite player, extending and locking out their arms in order to get separation from the player to elongate the time that the QB has in the pocket in order to get off a completed pass. Another thing to note was that slap tears among NFL players had significant practical effects. Although the overall incidence rate of slap tears was relatively low, they significantly impacted players' NFL careers. Players who had their slap tears surgically repaired missed considerably more time training and started or played fewer matches than those who were healthy. These results demonstrate the significant performance and career consequences linked to slap tears, as well as the increased risk of injury among specific positions. In conclusion, slap tears can influence a football player's ability to play and disrupt advancements in their career if not taken care of properly. While manual examinations can be beneficial, slap tears can only reliably be diagnosed with an MRI. Once diagnosed, the type and duration of treatment correlates to the severity of the tear and the level of play an athlete wishes to return to. Despite generally lower success rates for returning to high levels of play after a slap tear, it is always possible with proper care. Thank you, and here are my sources.